your stories, your service, your community. This is the Tango Alpha Lima podcast.
Welcome to the Tango Alpha Lima podcast, the American Legion's podcast where we tackle the issues that matter most to veterans, service members, and their families. I'm your co-host, Stacy Pearsall, here with a special episode for you. If you've spent any time on social media lately, you've probably seen heated debates surrounding the Take Care of America's Veterans Act, or TCAVA. Some veterans believe it's one of the most significant pieces of veterans legislation in decades. Others are concerned it could change future disability benefits for conditions like tinnitus and sleep apnea. Between the headlines, the memes, and the online arguments, it can be difficult to separate fact from fiction. So today's conversation is about doing exactly that. This isn't just another policy discussion for me because it's personal. I was medically retired from the Air Force after 10 years because of combat wounds I sustained in Iraq. Like thousands of other medically retired combat veterans, my military retirement is offset by my VA disability compensation. I'm also rated for tinnitus. That means this legislation could affect me from more than one direction. So today, we're setting politics aside, right? And we're focusing on the facts. What exactly is this bill? Who benefits? What concerns are legitimate? What's misinformation? And what still has to happen before any of this becomes law? To help answer those questions, we're joined by the American Legion's Legislative Director, Lyle. Cole and his team have been deeply involved in shaping and advocating for this legislation on Capitol Hill. And today, he'll walk us through what TCAVA does, where it stands, and why veterans across the country should be paying attention. Whether you support the bill, oppose parts of it, or simply haven't made up your mind, our goal today is to give you the information you need to make an informed decision. Cole, thanks for joining me.
Yeah, absolutely. Thanks for having me.
So I want to dive right in. Veterans have been hearing a lot about the Take Care of America's Veterans Act, TCAVA. It's a mouthful. But there's also a lot of confusion. At its core, what is TCAVA and why has the American Legion invested so much political capital into getting this passed?
Yeah, well, thanks, Stacy. I appreciate that question. TCAVA at its core is basically 60 plus different bills that have all been lumped together into one omnibus package. And it kind of spans the gamut of everything that we've been advocating for, in some cases for decades, like the Love Lives On Act and other provisions. So, you know, I think the conversation has centered largely around the Richard Starr Act, just because of the amount of just conversations and advocacy that has happened in the joint hearings earlier this year, and other things. But I can't really say at its core it's one specific thing, because it is a lot of different things. It expands access to healthcare, particularly for rural veterans. It ends the arbitrary cap on spouses, survivors not being able to remarry before 55 without losing their benefits. Obviously, yes, it includes a version of Richard Starr. There's a lot that this bill does, and it would positively impact tens of millions of veterans, caregivers, survivors, and their families. So we see this as one of the largest and potentially most impactful pieces of legislation to impact the broader veteran community, not necessarily just veterans themselves, like the American Legion family, the American Legion Auxiliary, the Sons of the American Legion. A lot of different organizations and people are supportive of this because it would impact their particular population. And I think when you say, why has the American Legion expended so much political capital on this? I wouldn't say that, you know, it's not a perfect situation. It is very nuanced. But when we took a look at kind of all the nuance, the politics of the situation, the policy, we said in an increasingly difficult budgetary and political environment, this is a great starting point. No bill is perfect. We're still negotiating with members of Congress in the House and Senate and the majority and the minority to try to make this as good a package as we can. The reality of the situation is we're on a bit of a time crunch because the center of controversy of this bill is the Section 108, which is the changes to tinnitus and sleep apnea ratings.
Hmm.
And our support kind of hinges on the fact that in 2022, VA promulgated rules to change these through regulation. Earlier this year,
For
go ahead,
somebody,
sorry.
sorry, for somebody who's dumb like me, what is
Oh,
promulgating?
it just means they publish the rules. Like they,
Okay, got it.
in the Federal Register, they put out the rules saying, hey, we're intending to do this, and that starts the public comment period where people can submit comments to the Federal Register either in support or oppose. Which, to be clear, we opposed.
Right.
Um, And then earlier this year, the Trump administration testified under oath that they were going to finalize these rules by the end of the fiscal year, so by the end of September. And before that, right, we only have about 20 legislative days left on the calendar,
Hmm.
which I know it's July, so but with the midterms coming up and members of Congress leaving for pretty much all of August and all of October, and they still have to figure out the appropriations and or the continuing resolution in September when they're here. We're running out of time. And the worst case scenario is we don't get any movement on this piece of legislation.
Hmm.
End of September comes up and VA finalizes these rules anyways. And the changes to tinnitus and sleep apnea still go through into effect. And now we've lost an opportunity, and we can go more into this, but we've lost the opportunity to find under congressional budget rules a pay for that's palatable, that's feasible, that can get through the committees to pay. Because we've tried that in previous Congresses, and I think even the opponents would say, we have pushed for this, and we've tried to find offsets, and we've been unable to get Congress to waive pay-go for these individual pieces of legislation. So this was their response: is like, let's put all this together and try to help as many people as possible.
Cole, can you explain what PAYGO is for somebody who doesn't speak the lingo?
Yeah, absolutely. So in 2010, after the financial crisis and the bailouts in 2008, 9, Congress passed a law called the Pay As You Go Act, which there's two types of spending in the federal government. There's discretionary spending and there's mandatory spending. Mandatory spending is what you think of as entitlements, Social Security, VA disability, things like that, that Congress they can change the underlying rule, but they have no control over how much money gets paid out. If somebody applies for it and they're eligible for it, they get it.
Okay.
Um, Discretionary spending is day-to-day operations of the government. So in VA terms, that's hospitals, healthcare, that sort of stuff. Um, as mandatory spending increases and VA total spending at VA's record budget is about 70% mandatory and about 30% discretionary. As mandatory spending gets higher and higher, the Pay As You Go Act basically says that Congress cannot pass a law that affects mandatory spending on the side of the House without having an offset. So if a piece of legislation either would increase the deficit to the federal government or reduce revenues, i.e., taxes, they have to find some other place in the federal government to offset those funds.
Okay.
And as mandatory spending increases, basically there's federal budget caps and then there's mandatory spending, and as mandatory spending increases, that delta gets smaller and smaller, so it becomes increasingly harder to find those offsets. So again, in context of this, we looked at an environment where it's getting harder and harder to find those offsets, and we've been advocating for that. And this was a way to kind of kill two birds with one stone and find an offset and pass legislation, a lot of which have already been through the legislative process. Most of these bills have gone through a hearing or a markup for amendments and things like that. And so that's kind of the calculus that volunteer leadership made.
Okay, so that's kind of where the misinformation is coming from. I guess maybe because a lot of people, one of the criticisms of the TCAVA is that you're basically robbing Peter to pay Paul, because the compensation changes for tinnitus and sleep apnea will help pay for
Yeah.
veterans today, on the backs of the veterans tomorrow. Um, is that a fair characterization, or are we totally, is this misinformation? Like, clarify it for me, please.
Yeah, I don't know that I'd go so far as to say it's misinformation. I just think it's lacking nuance.
Okay.
The underlying thing about, one group of veterans shouldn't be forced to pay for another group of veterans. Like, we already do that. Every time a veteran gets a home under the VA home loan, some veterans pay funding fees, and those funding fees go to other veteran programs, right?
Mhm.
Anytime a veteran is under 50% and goes to VA for a non-service connected condition, or they have another healthcare plan, they have to pay, in some cases, copays. Those copays go to pay for other veteran groups. So, like, we already do that. Um, and I totally agree that it's not necessarily when Congress is trying to find offsets. This is not an ideal situation. Under normal circumstances, we would not support this. I would say that there's a lot of conversations about this sets a precedent. Congress has done this before. They've legislated the VASR D. In the PACT Act, obviously, it was to increase presumptive conditions. But in 1998, they did it where they changed the underlying rules about how tobacco use could be calculated for certain veteran disabilities or healthcare issues.
Mm.
And that provided a $16 billion offset under the Transportation Equity Act. The irony is that veterans groups largely had the same objection then that they do now. And 15 of that $16 billion went to national transportation infrastructure projects. And the veteran community only saw about $1 billion from that offset that went to the Montgomery GI Bill.
Okay.
So I wouldn't necessarily say that it's misinformation. Like I said, I just think it lacks a bit of context. It's not ideal, but if the VA is already planning on finalizing these rules by the end of the year, then certainly we would rather see those go to veteran programs, which Congress has to do prospectively um, in order to keep them in veteran programs versus Congress or versus the VA finalizing these rules and that those savings as scored by the CBO going to general federal government debt reduction or some
Right.
other program that's non-veteran related.
As your example of like going back into roads or infrastructure, something like that. So it
Hmm.
wouldn't necessarily stay within the veteran community that's taking from.
Right.
That makes sense. What's interesting for me is that as I mentioned from the top, I'm affected by both sides of this legislation. And just for clarity as well, um, being a medically retired combat veteran, I could definitely benefit from the Major Richard Starr Act, and I want to dive into what that is exactly. But at the same time, I'm also rated for tinnitus. So, will if this goes through, which we know what you're saying it is, regardless of whether the TCAVA is successful or not, the VA is going to make these changes on tinnitus and sleep apnea. So, when these changes go through, how is my rating going to be affected? Do we know, like, if the TCAVA is successful, will I get the Major Richard Starr Act, but will I lose my tinnitus rating? How does that work?
Yeah, so let's tackle the tinnitus and the sleep apnea portion first of all. So whether TCAVA or the regulations go through, what those regulations would do if finalized is for tinnitus, it would take tinnitus from a 10% rating to a 0% rating as a secondary condition to either TBI or some other like hearing loss, something like that. So you could still theoretically get rated for tinnitus. And if you are rated for tinnitus or sleep apnea under current regulations, your disability compensation would not like automatically, you wouldn't lose your rating for tinnitus or sleep apnea unless you were to say go in for an increase for some other thing. You go to a C&P examination and the examiner notes something and they take a look at it theoretically, just like now, like if you were to go for a increased rating for not sleep apnea, but let's say, post-traumatic stress or something like that, and you go into an examination and the excuse me, the provider see something in your records that says like, oh, this is getting better or something along those lines.
Mm-hmm.
Theoretically, even now they could reduce your rating, but there are not any automatic cuts as a result of passage of TCAVA or these regulations as they go through. Um, Now, if TCAVA does go through, obviously no difference between the regulation, but for let's say Richard Starr, right? Um, it would end the offset, right? Um, I think you said you're Richard Starr. I'd be curious to see like what your particular situation is, so I maybe could go
Yeah.
into a
Yeah. So I was medically retired at 10 years, and I ended up getting CRSC. My VA disability is 100%, 90 of which is combat related disability. So I think the Major Richard Starr Act would impact me by, and correct me if I'm wrong, Cole, in my interpretation of what I've read, is that I would get my Air Force retirement back in full. I would um, do away with combat related special compensation and concurrently receive my VA disability, which, I mean, just for clarity, it's not, I think it's like $100 difference between what I would get from my Air Force retirement versus my CRC, but it's $100. So,
Yeah. So a couple things on this. If this version, which is definitely a compromised version of the full Richard Starr, which is what we've advocated for in years past, the reason that those versions of that bill have not passed, there's actually two reasons for it. One is Richard Starr is a piece of legislation that is housed the Committee of Jurisdiction in Congress is the Armed Services Committee, not the VA committee, right? So it's not a VA bill.
mhm.
And both Republicans and Democrats in the House and Senate Armed Services Committees have objected, even if it's gotten into the National Defense Authorization Act, to that bill for budgetary reasons, right? Um, and so it usually gets stripped out in the conference committee. So in the reason there's compromise on this one is because to get the armed services committees more or less to say this is something that we're willing to work with in order to include it in this package, these were the compromises that they said that they were comfortable with. So under the language included in TCAVA, career retirees with 20 plus years of equivalent service, they would have the full hypothetical longevity retirement pay as if not retired under Chapter 61 plus full VA disability compensation. For shorter service retirees, so less than 20 years, like your 10 years, you would receive the actual Chapter 61 retirement pay plus full VA disability compensation, or the lesser of the hypothetical retirement pay computed as if you had 20 years of service plus full VA disability compensation. Um, and it uses the existing definition from CRSC. Uh, uh, excuse me. CRSC becomes unnecessary in those cases. So
Mhm.
um, the reason that they came to this compromise was largely because, according to them, they said, we don't want to get into a situation where somebody that was medically retired with 10 or 15 years could theoretically make more than somebody who did the full 20 and also was rated for VA disability at whatever percentage it was. So that was kind of the compromise and the trade-off that they made. And it's important to note, like, obviously, it's still not ideal. No, again, piece of legislation comes without compromise, regardless of how popular it is.
Mhm.
Um, I spent 6 years advocating for service dogs for veterans with post traumatic stress, and the final bill was not what I originally had authored, and it came with compromise. But to get the armed services committees on board, this was kind of what they said, like, "Hey, we're comfortable doing."
Yeah. Um, Thank you for that clarification. It'll be interesting to see how everything shakes out. I also know that the TCAVA is you said from the beginning that it's an omnibus of different pieces of legislation. And one of the things that caught my eye was access to care. I live in the country. I live on a farm, so rural care is interesting. I have to drive an hour and a half, typically one way, just to get to the main VA. If I want to go to specialty care, then community care program is, you know, challenging at times. Mental health is part of this omnibus. Can you talk to me a little bit about what access to care is under the TCAVA umbrella and why it's important?
Yeah, so that's a great question. One of the key provisions in the TCAVA is the Access Act, which for years we have supported in testimony as a way to facilitate veterans access to care in the community if the VA was not able to provide them that care within a certain time or distance. So after the Mission Act passed, there were regulations again promulgated by VA that set into regulations what those like reasonable times or distances were. Now, over the years since Mission Act passed, we have seen the VA, because it was in regulation, in some cases kind of arbitrarily rescind or restrict access to the community for veterans when it was in their best medical interest. And the backstory behind this is there's an argument that the more access to the community expands, the more privatized the VA becomes, right? Veterans
Mhm.
rely more heavily on access to the community. And I'm not indifferent or insensitive to those criticisms, because to when we're talking about the amount of money that Congress has to appropriate to in-house VA care versus community care, like those arguments do hold some merit. The
Okay.
problem that I have with it is, unless we provide a lot of money for in-house VA infrastructure, veterans may veterans are going to need their care one way or the other. So restricting access to community providers and more or less forcing veterans to only use VA facilities um, hinders their ability to get the care that they need. So until we put a lot more money, and it's worth noting that this bill actually does provide billions of dollars for VA infrastructure and asks for a long-term infrastructure plan.
Hmm.
Um, but until we tackle that, veterans still need to get their care. And as long as the VA is coordinating that care and and funding that care, it still is fundamentally, VA care. So in this bill, for your situation for rural veterans, it locks in those access standards. It codifies it, so it removes the VA's ability to arbitrarily restrict a veteran's access to care in the community if it's in their best medical interest. Those provisions, that codification is sunset for after 8 years. So if it's working, great, Congress can reauthorize it. If it's not, Congress can come back and tweak it or change it. Um, there is also a expansion of access to critical access hospitals and clinics, which strengthens the ability for rural veterans to use local hospitals and clinics under community care, reducing that need for long drives to big VA centers. It also allows the VA to fire community care contractors more easily
Mm.
if they're non-compliant with network, quality oversight, things like that. It expands the highly rural transportation grants. So a lot of veterans, that don't have access to transportation to get to their appointments.
Hmm.
Um, there's a program where for-profit companies like on the ground can provide those services to veterans to get
Yeah.
them to their appointments. So for tribal veterans, rural veterans, and it adds funding for compliant, like ADA compliant vehicles. So,
Yeah.
so that's another.
My sister's a nurse in the VA, and she's
Yeah.
also a veteran, and she works with a lot of elderly folks who live rural. Like she lives on the farm next to mine,
Mhm.
and she talked about how important it is to have rideshare capabilities, and she helps them get access and stuff like that. So it's so important, and I'm glad that this is still something that's in the forefront of everyone's mind because access is really, really important, and the community care aspect of it too, and reducing those wait times and shortages because that does lead to ultimately shortfalls like in mental health, which is a great segue because, unfortunately, suicide has touched nearly every veteran in our community, directly or indirectly. I've lost friends to suicide, and just recently, my battle buddy and my close friend told me that she's struggling to get access to PTSD care through the VA. So, what specifically will the TCAVA do to improve mental health services and suicide prevention?
Yeah, it's a great question, and you know, I can empathize with that because I think the reason I got into veteran advocacy, I never intended to make it my career, but I had my own struggles with post traumatic stress, and at one point I was about that far away from becoming one of
Mhm.
those statistics, and I've had veteran friends of mine kill themselves, and so this is something that's deeply personal to me too. And one of the biggest things I will say, I've been banging on this drum for years, is that I don't think that the VA, 50% of veterans don't even use the VA on a regular basis. There's a whole swath of the population that has no touch points at VA. So, like, how do you tackle this problem when half of your population isn't even using the VA?
Mhm.
Um, one of the well, and moreover, not only that, the VA, I liken it to a large ship with a very small rudder. Trying to get it to change direction it takes a long, long time.
Yeah,
Um,
that's fair. Right.
yeah, and one of the reasons I think we're having problems with this is we still look at suicide through the lens of mental health, and I know that seems intuitive, but suicide's not always a mental health problem. Usually, it's a conglomeration of relationship stress, financial stress, things that the VA, from a clinical standpoint, are not going to be able to like treat. So,
Mm,
one of the biggest things that this bill does that I think is already positively influencing and helping with the veteran suicide crisis. We've seen success with something called the Staff Sergeant Parker Gordon Fox Grant Program,
okay.
which provides grants to organizations that are on the ground, local and state organizations that are not necessarily suicide prevention organizations. They're organizations that help out with transportation, right?
Right.
With employment, with relationship counseling, with just a general sense of purpose that a veteran may be lacking. This has been a pilot program for the last few years. We've seen tremendous amounts of success there, and it reauthorizes that program and provides funding for that program because until we reach those veterans that don't necessarily have touch points at VA and are not necessarily clinical organizations, I think it's harder and harder to fight this epidemic of veteran suicide. So that's probably the biggest thing that I think will help. That's included in this bill. But going back to kind of rural access, right? Healthcare access can be a huge driver if veterans don't have access to those resources, and it expands. It has improvements to telemedicine, including expanded authority for prescriptions via telehealth,
Mm,
and better licensing for providers for community for rural veterans in the community, so that veterans who don't naturally have those touch points that need some of that mental health care, they don't have to drive long distances. They can utilize telemedicine and virtual medicine in order to get some of the support that they need.
yeah, I mean, gosh, all of these things are so really important, and hard to cram everything and talk about everything that the TCAVA is gonna cover. Um, I'm part of the community that's one of the fastest growing in the veteran community, and that's women. And
Yeah.
this will also, touch on particularly women veterans' healthcare. Um, Caregivers, it touches on caregivers. What's gonna be the major changes for the caregivers under this? Can you tell me that?
Well, in the bill is included the Sherry Briley Act, which the House passed recently, which includes DIC, disability indemnity compensation. That has not seen a increase in decades, right?
Oh, yeah.
And one of the biggest struggles that survivors have is being able to they live with their veteran while the veteran is alive, and they have a certain standard of living because that veteran has disability compensation, right? And then the veteran, passes away tragically, and they now have to rely on less money, more or less, to take care of themselves and their families. So increasing DIC, which is what survivors receive after that veteran passes away, becomes a lifeline. And that's, like I said, not seen a meaningful improvement or increase for
Oh,
decades. So
goodness.
that would include an increase. Again, it's not everything that we have been advocating for. It represents, it's not as high of an increase as we would like to see, or as the community would like to see. But I think, this is an important point to touch on. DIC is not everything we want, right? Richard Starr is not everything we want. It's not the full bill that we've asked for. There are other provisions that are not everything we want. But the risk here is that we don't do this bill, we don't pass this bill in its form, and the status quo remains unchanged, right? These caregivers and survivors and people that don't have access to concurrent receipt at this point continue to be subjected to kind of these inequities. And as I mentioned earlier, in this environment where it becomes harder and harder to try to find offsets, it becomes harder for us to pass bills like this. Um, I'm sorry, I'm going to go on a little bit of a tangent here, but
No, feel free.
so there are some arguments, right? Like we should waive PAYGO, right? The American Legion has a resolution that we should support legislation that exempts veteran programs from PAYGO, right? The resolution calls for us to support legislation that would do that. There's actually no legislation that exists in Congress now that would do that. Otherwise, we'd be the first people to support it. So we have to operate within the existing environment that we're in. And the only offset that historically the committees have been able to use is an increase to the home loan funding fees for veterans that don't qualify for an exemption to those funding fees, an increase, which we also have historically opposed, increases to funding fees or the funding fee itself for veterans. Um, that's one of the only offsets that we have been able to use, or the committees have been able to use for years, because unfortunately the committees have to operate within their jurisdiction. So the argument goes, unless Congress waives PAYGO, and we have to try to find offsets. Like, where else in the VA budget would we be willing to cut in order to pay for an increase in another program?
Right.
Um, are you willing to cut VA research? Are you willing to cut funding for VA police? Are you willing to cut, come up with some sort of offset that everybody would be okay with, that would be passable in the committees that members would not have objections to? And I think you'll find, yes, everybody objects to this offset. We've said it's not ideal and we wouldn't support it under normal circumstances. But I would challenge anybody that's saying, hey, find another offset, to find an offset that nobody would have a problem with, that's passable. And people say, well, the DoD should fund it. The Department of War, Department of Defense should fund it. And again, I don't disagree. I think that it should be the responsibility of the DoD or DOW to fund Richard Starr. But unfortunately, the VA committees don't have jurisdiction over that. The Armed Services committees do.
Oh,
And they have routinely objected to offsets within the DoD or DOW, whatever you want to call it. And so we find ourselves in a situation where we agree this is not ideal, right? This is not something that we would normally support. But the reality of the situation we find ourselves in is, if these regulations for sleep apnea and tinnitus go through by the end of the year, and we don't act on this, the status quo is that survivors don't see an increase in DIC.
Yeah.
People that are eligible for concurrent receipt don't receive concurrent receipt. The Staff Sergeant Parker Gordon Fox program does not get reauthorized. Rural veterans don't have access to critical hospitals and local hospitals. There are not improvements to telemedicine and licensure. There are not investments into or significant investments into VA infrastructure that are included in this bill. There are not increased oversight and oversight into community care and to potential reductions in force. There's a provision in here that requires VA to notify Congress for 60 days with a risk assessment program before they go through with any sort of reduction in force. So there's plenty of good in this bill that if we don't pass it and the status quo remains unchanged, it's like a lose-lose situation where these regulations go through anyways by the end of this year. We don't get all these things passed, and we're, going before Congress next year and trying to argue for this stuff when they've repeatedly told us, no, find an
Right.
offset.
So, what can veterans do to have their voices heard about their feelings on the legislation at this point?
Yeah, so I would say that that's the biggest thing, and one of the reasons I wanted to come on here and do this is because um, unfortunately, I feel like the arguments against this have been distilled into very simplistic messaging and talking points, and I'm hoping that people go to legion.org/TCAVA. They watch this podcast. They get educated. Anybody listening to this is free to email me about it or call me or whatever, and we could talk. We did a voter voice on the Legion's website, so they can contact their members of Congress and say, hey, we support this bill. And I would say that one of the organizations that opposes, I had a conversation with my counterpart in that organization, and we had a good constructive conversation about this. But the sense was, look, like, it's not ideal. We can't support this. We're just going to wait until the political climate becomes more palatable, and maybe we can waive PAYGO or do something like that. Um, so I think there's general agreement about the problems in this bill. There's agreements about all the positives that are in this bill. The disagreement comes from should we take this bite of the apple now and come back for more later, or should we not take a bite out of the apple and try to get the full apple later, right? I think for veterans to have their voices heard, veterans are making their voices heard and known online. I've seen plenty of it, and I try to reach out to as many people as possible. But I would just be wary that social media doesn't always necessarily reflect the true conversation that needs to
Right.
be had
Yeah.
about all the nuance on this. So.
Yeah. Well, Cole, thank you for taking the time to walk us through a very complicated piece of legislation. As we've discussed today, the Take Care of America's Veterans Act isn't just one bill. It's a package that touches everything from healthcare access to mental health to caregivers, community care, research, and military retirement. So, if it also raises the difficult questions about how we fulfill our promises to today's veterans while protecting the benefits for those who will serve tomorrow. And as someone who's directly affected by this legislation, I understand why veterans have strong opinions on both sides. That's exactly why we have these conversations like this, and they matter. It's easy to react to a headline or a social media post. It's much harder, but far more important to dig into the details and understand what the legislation actually says. So whether you support the TCAVA, oppose parts of it, or are still making up your mind, I hope today's conversation has given you clearer understanding of what's at stake and encourage you to learn more forming an opinion. So be sure to follow Cole's guidance and visit the American Legion's website. I think it's /TCAVA. We'll have those links in the show notes. But most importantly, remember that your voice matters and stay informed, read the legislation, ask questions, and let your elected representatives know where you stand. No one has a greater stake in these decisions than the veterans and the families who live with their consequences every day. And so if you found today's episode helpful, please share it with another veteran or military family member. The more informed our community is, the stronger our collective voice becomes. So thank you, American Legion. Thank you, Cole, for your time. And thanks for listening to the Tango Alpha Lima podcast.